Okay, I see it's 9 o'clock and time for the meeting to get started. I'll call the Neighbors of Dunn County meeting to order. And looking at the roll, we have 4 members here. Don Keeter is not here. So we do have a quorum. The minutes were sent out to you. Any corrections or additions? If not, I'll take a motion to accept the minutes, please.
I second.
Okay. So it was Corley and Sean, first and second. All in favor?
All right.
Aye. Okay, minutes are accepted. Was there any public comment? Okay, no public comment. And then at the request of the chair, number 5, introduction of Neighbors of Dunn County department heads.
All right, so I have 2 of our department heads here today. So I have Laura Briesmeister and Alyssa Dowdy. So they're just going to introduce themselves and kind of say what they do at the Neighbors.
My name is Laura, and I am the social services mentor at Neighbors. I have been there since 2013. I do admissions, discharges. I assist with investigations and advocate for the residents.
Investigations?
Yeah, if there's any investigations of abuse or neglect, I assist with that.
Okay, and I'm looking at you on the organizational chart here. In 2013. Wow, okay. Thank you, Laura.
Hi, my name is Alyssa. I'm the Life Enhancement Mentor and Volunteer Coordinator at the Neighbors. I just started last year in June, so still pretty new. But I help coordinate all of the activities and programs across campus, outings for residents, things like that. Also doing a bit of fundraising for our new bus, hopefully coming soon. So if you see any emails about fundraisers, those are probably from me. So, yeah.
And what are you at now for the bus?
We're at about $40,000 for the bus. So still chipping away. We do have our basket raffle and our golf tournament is on Saturday. So hopefully that'll add a nice chunk to it as well.
Good, good. Thank you. Any comments? Supervisor Bjork.
Mr. Chairman, I met with Lisa at the Dunn County Fair, just happened to run into each other and had a very nice visit. And it was nice to see you there.
Yeah, the residents had an awesome time submitting stuff to the fair. So it's really awesome that we have a nice open class and they got their ribbons and got to deliver those back after I picked up their stuff. So they're really excited about it.
Thank you for coming.
Yeah, thank you. And, you know, if you want to go to work, you know, I know you've got plenty to do. Thanks for coming down. And it's nice, Alyssa, I've seen you several times, but always with a mask. So it's nice to see the smile on both of you. Yeah. Okay, report of the Neighbors audit.
So we have April from Clifton Larson Allen on the Zoom call. So she will be doing this portion.
Good morning. Can you hear me okay? Okay, good. So yes, as Carmen said, I am April Anderson from CLA, here to present your 2021 audit. And so you should have received the full audit report, which is about 45 pages. But I have the 1-page summary that you also should have received. Hopefully you all have that in front of you. And so it's a 10-year summary of the overall results for NDC. And so I will kind of mainly focus on this, kind of supplementing a little bit of what is in the full financial statements. So to start off, on the top of the summary, what you see there is the balance sheet, your assets, and then your liabilities. And then ultimately the net of that is what your net position is. And so this balance sheet information coincides with page 5 of the full audit report if you wanted to go back to that and see where these numbers are pulling from. And I won't key in on or go through every line item that you see here, because a lot of the time on the balance sheet, the assets and liabilities, changes from year to year could just potentially be timing of things happening from one year to the next. One thing I did want to mention, you'll see the operating cash and investments. So that is down to 0 again, like it has been for most of the last 10 years. And I'll get into the details more. You did actually have available cash at the end of the year, but with the restructure of the debt last year, we moved, or the cash that was available was paid back to the county for that debt. And so again, I will get a little more into that a little further down, but that is generally why the cash was brought down to 0. One other thing I wanted to key in on in the balance sheet asset section is your accounts receivable. You may see that. Oh, was there a question? I thought I heard a noise. Nope. Okay. The accounts receivable in 2019, it was at about 1.8, which it was relatively high compared to the years prior. And now it's come down to 1.2 million last year and then 879,000 this year. And that's not necessarily that your revenues did decline a little bit this year, but in 2019, you had a major transition in staffing. And so collections were slow and you had higher receivables at the end of the year. So again, kind of timing of things and that your collection process is better now. And so you're able to keep up with those collections. And so your balance isn't as high. Then when we get down to the liability section, you'll see that some of the major items here that have changed over the last couple of years all deal with that debt restructuring that happened last year. And so that removed the interest payable. You had a deficit fund balance or net position. And so due to other funds, you were basically kind of being loaned cash, operating cash from the general fund. But with the movement of everything last year, you don't have that amount due to the general fund any longer. The one other thing that you'll see there is an other liabilities line. Last year, that was up to $860,000. And what that relates to is actually some of your provider relief funding from as a result of COVID that you received last year, but hadn't actually been spent or applied yet. And so you'll see that that went down in 2021 to the $335,000 because you actually applied some of that funding in 2021. And then that liability will continue to decrease as you spend those funds down. So then just going down a little bit further in the liabilities, again, with the debt change, you'll see that you no longer show any bonds or long-term debt liabilities for the last 2 years on your financial statements. And so, as I said, then the net of all those assets and those liabilities is what's considered your net position. And so you'll see at the end of 2021, your net position was 15.569 million, which was a decrease, an overall decrease of about 59,000. So very close to kind of a break even, if you'd want to call it that. And so again, with that net position, you'll see how that changed last year. You had been running a deficit for many years because of the bonds and the long-term debt you were carrying. But last year, with the change of the county taking over that debt, you now show a positive net position. However, that net position is broken out into 3 different categories there. So you have your net investment in capital assets. And so that is the value of your capital assets, mainly your building, your new building there, or newer building there. And that would be less any debt. And so you'll see that previously it had been negative because of the accumulated depreciation on that asset value and the debt. But now with the change last year, you're showing positive of 15.8 million of your investment in capital assets. The restricted amount there of the 1.8 million relates to WRS, your Wisconsin Retirement System participation as a county, and an asset that you're carrying up in your balance sheet is what's restricted there. And then your unrestricted balance is basically the net or the remaining amount. So you'll see that that's actually a deficit. But with the restructuring of that debt last year, you'll see that the deficit used to be at 7.7 million in that unrestricted, and now it's down to 2 million. And so hopefully you'll be able to bring that unrestricted amount closer to a positive balance eventually. So I know I had mentioned that your overall debt position was a deficit of 59,000. So expenditures exceeded revenues by that 59,000. But in that last section with all the numbers for the 10 years, we started to break it out a little differently because there's a lot of moving components of what goes into that balance. And so your actual income statement and the details of what goes into your revenues and your expenditures for the year are on page 6 of the full financials if you want to supplement this information with the detail information. So in there you'll see that your operating revenues did decline just due to the decline in some of your numbers for the year and the number of residents, but your expenditures also declined accordingly too. And so what on page 6 of the financials, it does show your loss from operations is 1.5 million. But within that number and what we kind of take out and separate down below in this summary is that in that 1.5 million, you have 680,000 that is depreciation expense on your building. So again, that's not really necessarily an expense cash going out for service, for expenditures and supplies and things that you need to provide the services. That's purely an accounting function of depreciating the value of your asset of the building. And then also included in that that total operating expenses on the income statement is I mentioned the accounting standard for your participation in the Wisconsin retirement system. And so that is actually $451,000 positive in that calculation. And then the last kind of big item that isn't necessarily a normal operating expenditure that is incorporated in this number is that your true balance for the year, or your income for the year, was 1.5 million. So after we kind of take out the depreciation and we make reference to the change in the pension and OPEB liabilities, your true results for operations is that your revenue exceeded your expenditures by that 1.5 million. So it's kind of taking those accounting nuances that are part of the financial statements because you need to report according to the accounting standards, but backing out some of those unique instances or those different type of accounting numbers that go into that. So when you had the income from operations of 1.5 million, so you had that available, and a transfer of 1.3 million was then made, or that was your available cash at the end of the year. So that was transferred back to the general fund, the county, for your portion of the debt. So what you could repay on the outstanding debt that's still out there. Due to that restructuring last year, you took the debt off of your books, and then each year you're paying the county back what you have available to pay them back with. And so that was 1.37 million. So then at the bottom of this summary, you can kind of see how things have fluctuated over the last 10 years. Again, you'll see on the right hand graph that the income loss from operations has actually been positive for the last 10 years, except for the 1 year. And so, in 2021, it was exceptionally positive at that 1.5 million. And again, this is the operations taking out the depreciation expense and some of those other accounting standard numbers that have to be reported in your financial statements. So just trying to break it down to see a little bit more as far as what maybe your true results from operations were there. So, and then the last thing we have as far as the last set of numbers right above the graphs is called the current ratio. And so we look at that, and what the current ratio is your current assets, so your available cash, your accounts receivable that are considered to be collectible closely after year end, compared to your current liabilities and payables, bills that you have to pay right after year end. And you want that to be at least a 1-to-1 ratio. And you can see that it was at 1.73. So again, you had available resources, cash and accounts receivable, to be able to pay your current liabilities at 12/31/21. So as I said, we kind of pull out the key pieces of information and the highlights here in the summary to supplement the overall report. Is there any questions about what I went over, or any other questions if you guys were able to review the report and had anything?
Any questions from any of the supervisors? Carmen, you have any comments or anything on it?
No, I know that we've had multiple discussions about this 10-year summary and involving April, as well as Beata and Jane and Chris, about going forward on the end result being above what it shows us in the negative. So we're transferred out more than we had. So we've talked about that, and I think we'll probably bring that back at a future meeting for future discussion on how much we should be taking out versus cash, which I don't think we're prepared for today, but for next year's audit, it's a discussion we'll bring to this committee at some point. But just because we took out 1.3 million and it put us in a negative for net position at the end, which even though we had positives, that's something we'll be talking about in the future probably, but discussion for another day.
Okay, I guess no questions.
Okay, well, if anything does come up, Carmen, Jane, Beata, Chris, all know how to contact me, so certainly feel free to reach out.
And thank you. You always explain things well. I appreciate it.
Thank you. Have a good rest of the day.
Yeah.
Thanks, April.
Thanks.
Okay, that was relatively painless and gives us a lot more thought, I think. Things aren't as bleak as some people think sometimes. Okay, next up, I think, Carmen, you're on for a little bit.
All right. So as always, we start with Quality Assurance Steering Committee updates. So we did have a meeting 2 weeks ago now. We talked a lot about our East survey, which was that week. So it was actually the same day as exit. So I'll talk about that a little bit later, but that was the primary focus of our Quality Assurance Steering Committee in relation to, we had our annual East survey. So we talked a lot about that. So I'll get into that later. We did also review our normal monthly reviews for clinical standards, which everything looked okay. We also went over that it was the end of reporting for fiscal year, or for CMS's fiscal year Q1's reports were due. So we just double checked that all of that was good as well. So that's for our PBJ reporting, which is staffing, as well as our NHSN reporting, which is vaccination and COVID positivity tracking, that gets reported to the CDC. So they have deadlines basically to make sure everything is accurate in the submission for each quarter. So they're well after the quarter ends, but that was the deadline for doing so, is the 15th. So we went over that, but everything else was pretty much standard for that meeting.
Any questions? Nope.
All right. And next is the employment activity report, which I'll have Chris go over.
Hi, good morning. Can everybody hear me?
Yes.
So in your packet, you did get the employment activity report for July. Just kind of skip down the recruitment, pretty much stays the same. Go down to number of interviews. We did a total of 16 interviews last month. Out of those, 6 positions were offered, in-house positions. I didn't count the agency on those. And then positions that were accepted were 6, and one was asking more than a step 3. And we were able to offer that and was accepted. We had 3 resignations for July. We had a full-time LPN move closer to family. Full-time CNA took a job with a different facility, and a full-time cook. There's no reason, he just walked out. Then we go down to open positions, those are adjusted with the onboarding and offboarding. Go down to leaves of absences, that still remains low. There will be quite a large uptick in that August, September as our students start returning to school. Work comp lost hours for July, we did not have any lost time. And if you go down to the red italicized on the bottom, it discusses the COVID, missed to COVID issues. It was roughly 72 shifts or 648 hours that were lost due to COVID related, either being positive or having to be out to get tested.
Chris, I'm curious, up there in resignation reasons, took a job with a different facility. Was that a skilled nursing facility?
It was, but it was out of the area.
Okay, thanks. That's good.
Quite a ways out of the area, like Wausau.
Okay, thank you.
All right. In addition to Chris's report, I also have some workforce crisis reports for each of you to have. I can pass them out. These are distributed through Leading Age, which is our association. Just pass them down. This is a report that's given from the association, has a workforce. They're each 2 pages, so make sure you grab 2. This is something that you can have as an advocacy tool, as well as just some information. It basically shares how large the crisis is for healthcare, as well as other industries, but primarily healthcare, and then some ideas of how to help solve the issues or make it easier on healthcare entities. So this is something that was finalized by Leading Age this month. So thought it would be good for the board to have, as well as we'll be bringing this with the governor's meeting today as well too. So
Yeah.
Just in relation to workforce. Any questions on employment at all?
Supervisor Witzel?
So are you pretty much fully staffed to this point now with nurses and everybody?
No, so that's what the act or the
Employment, yeah.
the open position. So I would not say we're fully staffed. We do only, we're currently not admitting residents, which I'll get into a little bit later. We're not admitting residents due to staffing concerns. So we only admit to the point that we are able to staff. So we are fully staffed when we have people, everyone show up and everything. We have the schedule filled, but I would not say we're fully staffed as we have several open positions.
So do you, so are your wings or sections any of them empty or anything?
Yes, Arrowhead has been closed for over almost 2 years now. It was closed in 2020 in November, I believe it was right around Thanksgiving. We closed Arrowhead, so that household has remained closed. That's one of the central households. And then Fireside currently has 9 residents in it.
And the other one's open too then? The Fireside, there's 3 of them, right?
So across campus, we have 9 households. So 8 of the 9 are open. Fireside is only about half full right now. And Arrowhead is fully closed and the rest are fully open.
Yeah, thank you. And if we had staff, we could easily fill them with the people that want to come in.
Correct.
Okay, thank you.
Mr. Chairman.
Yes.
Carmen, have you in the past, or maybe I've missed it, as far as the staffing positions that are staff from outside the area that may be living in hotels and working, how has that changed? And are we, I mean, because only need to know that, I would guess, because aren't they quite expensive?
Yes, so they are expensive. So that's the part on here that says filled with agency in the red on the open positions. Agency staff would be the staff that are coming from out of area. Some live in hotels, some are out of area but close enough to drive. So I know we have one that lives in Mondovi, so she doesn't live in a hotel. She drives in to work. But primarily they do live in hotels. We pay a higher wage per hour, but that includes, we don't in addition pay for hotels. So their higher wage an hour gets paid directly to the agency that they work for. Then their agency pays them their whatever they make per hour from them, as well as a stipend for the hotels. So they are quite a bit more expensive, and that's it actually isn't in the report this month, which we'll get to for agency costs due to some invoicing issues with having some staff out. So it looked unrealistic this month, so we just didn't include it. But in the previous months, we've always had a list of the agency cost. So that breaks down the actual cost of what we're paying per month for that.
I guess I'd be interested in seeing how that trends.
Sure. Yeah, that's in the every month besides this month, we have a agency cost per month comparison from the last month. So it would have been in your packet last month and the months previous to, and it will be next month.
And then one last thing.
Sure.
And not wanting to be critical or nasty or anything, but I was told that we had a person that was working for us and that had living in a motel, had to leave the job to go take care of the dog that was barking at the hotel. Is that just a rumor or story or I mean, it's one thing if you're working for us and your kid is sick at school and you gotta go pick them up.
Mhm.
And it's quite a bit different if you're working for us and you have to go to the hotel to quiet down your dog.
That person no longer works for us.
That doesn't make me happy or sad, but I'm glad to hear that.
You're strict.
Yeah. There were multiple other issues. Any other questions for me on employment?
Sean?
It looks like the COVID hours are going up.
Yes.
Yeah, okay.
So they are going up, and I will be honest, next month is going to look very nasty for COVID hours. Again, I'll kind of get to that a little bit later in the COVID update, but we have had a pretty significant increase in COVID on campus. I think that it's a general thing in the community as well. We're seeing more COVID bringing its ugly head back again. So it's affecting us with hours and staffing as well. So July looked worse and August will look even worse for COVID hours. Mhm. Any other staffing questions?
Yeah, thank you for the questions.
All right, I will go into resident referral report. So that's on the back side of that. At the beginning of the month, we had 109 residents. We had 86 referrals. We had 10 residents admitted, so we were admitting this month. We were at a stable point for staff for a while in July, so we did admit some. And we did have one still in the hospital at that time, so that 10 does also include readmits. We had 76 not admitted. This normal spiel for reasons to not admit is primarily based with COVID outbreaks as well as staffing and everything else with that. The end of the month, we had 109 residents. We had one resident transfer to another facility. This person was going closer to their family. They were admitted to us when the place they wanted to go to close to their family wasn't accepting, and then they were accepting, so they went closer to home. We had 5 deaths and we had 10 discharge. So it's basically in and outs based on the time frame, so it doesn't completely add up. You see a higher number in discharges as we have had a higher number of rehab residents, which we are happy to have for the time that we can. That is typically the household that would be shut down or stop admissions to first, just because we can't kick people out of the long-term households. So it's easier to shut down the short-term households due to staffing because they're coming and going versus a long-term care household would be more difficult because we would have to move people within the facility and it would take a longer time to stop admits to those areas or shut down a different area. But more rehab patients does mean more Medicare patients, which is a higher bill rate as well. So that is fortunate for financial situation as well. So we did have an uptick in that comparatively speaking, which is a good thing. Our referral sources were similar, Menominee and Eau Claire Mayo. We actually did have a few from Barron's Hospital. I do believe that's primarily because Menominee Hospital has been very full. So they have had to have people from Menominee go to Barron, as well as Rochester. So we have seen quite a few people that weren't able to be hospitalized in Menominee due to how full the hospital has been. So they've been rerouted to Barron. And I believe our census today was 107, unless we had a discharge today, which I believe was a possibility. So slightly below what we were at the end of July. Any questions on referrals?
No, I guess not.
All right.
Thank
well,
you.
Thanks. We'll go on to Scott's report.
Good morning, everyone.
Yes, Scott.
The big topic, I guess, in facilities would be the life safety code portion of the East survey. They came in, I guess, full force with the state engineer, a trainee state engineer, and the federal engineer were here. All three. And it was Brady's first survey, so he was a little nervous, but he did very well. We came out of it with 4 minor sites. There's a couple of penetrations or 3 penetrations through a firewall on the one side. From my understanding is that the firewall has to be caulked with fire caulk on one side. The engineer looked at the opposite side where it wasn't caulked and decided he was going to cite us on that. So we got that all taken care of. That's done, fixed up. There was an exterior sprinkler head that was dirty, they found. And then East building got the same site that Central did with the not having an enunciator panel at a 24-hour staffed location. And then the last thing, the fourth one, they said that we have to run our emergency generator 4 hours every 3 years. Now, I've been in maintenance for 22 years, and I have never heard of this one. I talked with Bill Harmon, he had never heard of this one, but now they're saying that they sent over the code on it, that with a spark generator, so this diesel generators are excluded, ours are natural gas. So if you have a natural gas or a regular gas generator, the test on them has to be done. It has to run for 4 hours every 3 years, and you have to document that. So we didn't have any of that documentation, so there was a site. Brady has already worked ahead on that. He's running generators to get the 4 hour run done, because you can use that as a monthly test on your generator. So he's already doing that, getting documentation up for that, so that we're covered there. We went ahead with getting the fire alarm panels, enunciator panels for East and West, got that process going. And while they were here for East survey, the federal engineer checked back up on our Central site of getting the enunciator panel installed at the nurse's station in Deerview. I've been working on the enunciator panel for Central since our site back in December, and dealing with Permar security on it. And it was a long drawn out process. It finally got installed Tuesday of this week. They came, installed that one, got it done. State engineer was back this morning to follow up on that. He followed up on it, and he just needed a timeline of how events happened with Permar before they installed it. So I gave him that, and that's all good now. So he's taking that back with him. And then, I guess there's one other thing that, Mark did give us a heads up on for future that, the federal engineer has been looking at. So he's gonna send that code over to me and we'll look at being proactive to getting that. It's signage by our gas meter shut off on the outside of the building. So at least we got a heads up there. We can get it done before he tries to cite anything. Other than that, it's been working on equipment that needs repairs, dishwashers mainly. A few other things here and there, but you guys are doing really well, keeping things going and keeping up with, work orders. Any questions?
Was it lack of supplies for the enunciator panel?
Sean,
No.
go ahead and put,
It wasn't.
No, it wasn't. It had to do with Permar, getting the plan submitted to the state and the fees paid for that. They didn't, they finally admitted, Permar admitted that they could have handled the process better on their end. So that was good that they did that. So now, working with them on, east and west buildings should be much better, much faster.
Okay.
Yep.
So Scott, how many are in your department that work with you or under you?
So I have three, say, facility technicians. One is, the one that is over at the neighbors is actually titled a maintenance specialist. So there's three, and then I have 4 facility workers. And then, my contracted custodial staff, I have, 5 of those.
Okay, thank you.
you got that dirty sprinkler head cleaned though, huh?
Yes, Brady was on that right away.
Okay, any other questions? Thank you. Well, next up,
All right, so I'll go over East Survey. Obviously, Scott already went over some of that. We actually have not received what's called our Statement of Deficiency yet, or SOD, which is what we get from the state. 10 business days is a maximum they have, and today is day 10, so we will be getting it today. But we haven't gotten our official statement of deficiencies yet, so everything that they told us when they left is all preliminary, so they could have the same sites, could have different sites, could have no sites. We don't really know until we get the actual one. So the sites that Scott went over, those are the ones we'll probably get, especially with a federal surveyor there. I doubt those will change, but they can. And then we also had 3 minor citations for the health, safety or health part of survey, which again, aren't finalized yet. 2 of those citations are citations that almost every nursing home in our region has gotten that's had a survey this summer. And are they related to bed rails or side grab bars? Every nursing home I've talked to has also gotten the exact same citation. That was a focus that the surveyors have been on because in a different region, there was a resident who passed away due to being entrapped in a side rail. We do not have side rails on our beds, but we do have grab bars, which they are considering the same thing. So 2 of the 3 citations we got were in relation to doing assessments of if residents have the grab bars on their beds. Our beds come with them on them. They are also where the remote control for the bed adjustment is on. They're about this big of a loop. They're not a full side, half side, anything like that. But they're there for grabbing on to assist with rolling, transfers, adjusting, as well as for the remote control. So one of the citations was on the nursing side of the assessment. Then the other citation was on the bed maintenance side of the assessment. So every year there is a bed assessment done by the maintenance department. We have been doing it. They wanted to see more of an assessment that had entrapment specifically as an item that we review. It was something that was a focus. I had a call with our whole region of administrators last Friday, and 4 other nursing homes that have had surveys in the last month also received both of those citations. questions. So it's something that they would like us to do differently now. The regulation on that has been the same for many years, as well as our beds we've had since the building was built in 2013. So we've never had any question of it before, but we'll fix them and go forward on that. It's nothing will have to change on the beds or get new beds or anything like that. It'll just be assessments that need to be done. So we are working on getting those done for all of the residents. And that was our survey was only in the east building, so we'll have that fixed before they come to the west building. And then we won't have that citation again. The other citation was due to one of the kitchenettes did not have enough documentation on fridge temperatures. Twice a day, all refrigerators have to be checked to make sure that they are at the proper temperature, and there was a couple shifts missing on one of the logs, so that received a small citation. So that is primarily just staff education on making sure that anyone that's working in the kitchen on shifts checks the temperature log. There was no harm or injury or anything like that. And it was missed one shift, and the next shift it was within range. So most likely it didn't go down, but it's still a requirement to be checked. So we will be educating staff on that once we get the formal statement of deficiencies on what we received as citations. In regards to the enunciator panel, the one that we got the same citation as Scott mentioned, we are fixing that in west as well. The reason that we didn't fix it in east is because the shape of the buildings are different, and where the enunciator panel was in central is much further away from staff than it is in east and west. So we didn't think we needed to fix it in east and west because we thought that they could hear it from where it was. Surveyors still didn't like it, so now we're going to fix it in both of them, so we won't receive that citation in west as well. The shape of the buildings of the outer two neighborhoods are much smaller, and the enunciator panel on central was right up front by the front door, which is much further away from households than where it is in the other two, but they still were not pleased with where that was. So we will be fixing it, and it this time, as Scott said, won't be as big of a hassle as it was the last time. So any questions on survey at all?
No? Okay, you're patient. You have to be patient to work here, I guess, and then the survey comes through.
Yeah, and
Okay, thank you.
we will be having West survey as the next survey. So they are very behind on surveys. So this was on the 15th month, which is the last month that they can come. It has to be between 9 and 15 months. And East was on 15th month. West is now currently on their 12th month. So sometime in the next 3 months, we will have survey in West.
Okay, thank you.
All right, COVID-19 update. So as I mentioned before, we have had quite an increase in COVID-19 situations over the past couple of weeks. Not so much in July. I know now that our meeting is later in the month, we're kind of back a month, but in the month of August, we've had a lot of COVID situations involving staff, and now we actually do have an outbreak in our central neighborhood of residents. Fortunately, all of our residents who have had COVID are either completely asymptomatic or very mild symptoms. We found out last Thursday that a resident tested positive. Whenever we have a staff or resident test positive, we have to test everybody that would have been in contact with them and all the residents in that household. When we did that same day, we found 5 other people who were positive that were completely asymptomatic. So it is a positive thing. It is proof that our vaccination efforts and the infection control efforts have been better, comparatively speaking, to beforehand when we had residents getting very ill and even residents passing away. So we're happy that people aren't getting sick or as sick, but it is still a process whenever we have anyone that is COVID positive of wearing N95s and staff education, and residents are unhappy when they have to stay in their rooms on COVID isolation, as well as it does take more time to assist them with things because staff have to gown up, change their masks, put on gloves, put on different goggles. It's a process. So we'll be happy that hopefully we don't have any additional positives, and they'll be out of isolation on the 28th. So of the ones who tested positive last week. So we're hopeful that that was quite a few in a day, but hopefully that's all it ends up being, so.
Any questions? Yeah, with as much as there is in the community, you guys are doing a good job. So, no questions, number 8 then?
Mhm.
Jane, you're in person. It's nice to see you here.
On the vouchers, are there any questions on the vouchers?
Any questions? No?
Okay, my documents may be stapled differently than yours, but I'll start with the campus census is one that I produced. The census, of course, is not keeping up with what our projection was, therefore the revenues aren't as high as we projected, nor are the expenses. So we continue to do very well on our Medicare A census, and the others are behind where we see the vacant rooms in Central. So that's how the census is affected at this point. The aging report, it is a little bit higher. Again, we are working on some old debt issues, clearing up some write-offs potentially now. And then with an increase in Medicare A, that takes longer to collect those fees. So that's part of the aging process, but it's still looking stable and good. The financials then. And after that, I think Carmen can talk to the fact that we don't have the report for the agency staff because we had some invoicing issues. So you'll notice on the financials for the campus statement that it looks like the nursing expense is under budget, but truly it's not because the invoicing for the last month hadn't been done in time to get it onto this report. So it's not included. But we'll start at the top of that report, first of all. The revenues. Like I said, the Medicare A revenue looks good. When people are on COVID isolation, it helps our Medicare A days and our revenue slightly there. The other ones are lower due to just vacancies in the building. Supplemental payment we didn't post for the last month because we don't know what that will be. It'll start a new cost report year and that amount will change next year. Next month, we will estimate for it. As we know more about how that's going to play out with COVID and the provider relief funds and how much they might actually give us for the supplemental. Senior meals are on track, doing well. The expense side, like I said, the nursing services looks like it's doing well, but it's actually higher than that. We'll find that next month in our financials when we get caught up with the invoicing. Dietary is is doing well, which is directly related to the census, but the food cost is up 8 to 10%, and we're projecting next year for it to go up another 8 to 10% for dietary costs for the food cost. Property ownership does include depreciation. Next year, the budget may look different, and these sheets may look different depending on if and what your preference is to see depreciation in or out of the budget. So there's some changes in how we present the budget to the board as far as depreciation that you'll get into in your budget meetings. But think about that. It's a non-cash item that is currently included in these financials. Therapy for the month has posted twice because we had an invoicing issue with a change in ownership of the therapy company's address and such. So we skipped last month's billing and held it until we knew who we were really paying on that. We're pretty picky on paying the right party. So at the bottom, you'll see the net income and loss is a positive 16,000, but with the other items that aren't posted here as expenses, it, it isn't that, positive. So we'll get caught up a little bit more next month and get a more realistic number.
So Jane, the big difference then really is the nursing services. Yeah, some other minor changes wouldn't be nearly as much.
Nursing services and also facilities bills, they bill us for those staff people. We subcontract with facilities for their staff. And that hasn't been posted for 2 months. And then it's always a month behind. They had a staff out for, I think, 6 to 8 weeks. And there's a new finance person working under Sarah, and she has been trained now to do that. So we're broadening our depth as for who can go through those numbers and pull the data and pay those bills. So those will be all posted for next month as well.
Okay. Questions?
I have a question. With the bistro closed, what did we have $460 there for?
That's the license. We have to pay public health, the licensing,
Okay.
restaurant licensing fee every year.
Yeah, it's a little bit silly to pay it when we're not open, but if we were to not renew it, we'd have
Yeah,
to
it'd
go
be
through
difficult.
restarting a
Yeah.
business again. So we've considered the small cost of paying it a little bit easier than if we were to decide to open it, we'd have to go through a recertification of it being a kitchen.
Yeah, the total cost of doing business there, that makes total sense.
Good catch. Good catch there.
The only other thing I have to add, as Jane mentioned, so we don't have the agency cost comparison on this month. As if we looked at it, it wasn't accurate, so it just was not worth sharing because it would paint a very different picture than reality. So it wasn't really worth putting out there. So we are behind on our agency billing, which we're working on getting caught up on. The person who was previously coding them and getting them from the agency is currently on a leave of absence. So we have had to redirect the bills to the right people and then have them coded and processed and entered and paid, all of the things. So we're a few weeks, if not months behind on that. So we're just catching up on that. So next month is going to look real bad for agency because it'll be 2 full months of agency in 1 month, but it'll be offset from this month not having really any in there as we're just catching up on paying those bills. They were sent to someone who was not there to process them, so we had to have the agency resend them to all of us. And now we're working on which ones we got covered and which ones we haven't gotten covered. So we're working with the agency on that to make sure they get paid because we need their staff, as well as making sure we have all of it done correctly so we're not overpaying for things as well.
Any comments, questions?
No, but that's,
Okay. So before we go on, so are we done with 8A then?
Yes, we'll need that approved.
So before we go on to 8B, I would take a motion to accept the vouchers.
I motion.
Okay, Sean first, Corley second to accept the vouchers. Any other comments? All in favor? Aye. It's passed. So let's move on to 8B then, the legislative agenda.
All right, so in your packets, there was a staff report. It should be on the, I mean, how mine's printed, it's on the backside of the minutes, but this is a staff report that we do annually for the legislative agenda. I know that was brought up, I think 2 county board meetings ago, to have at all committees to discuss legislative items for next year's legislative agenda. That will then be discussed at a later county board meeting. We have had pretty much the same legislative asks on all of our agenda items, primarily related to reimbursement as well as staffing concerns. It is all kind of one and the same. Our reimbursement, it all basically revolves around staffing. The reimbursement ask is due to the cost of staffing. We are seeing inflation rates going up, but our rates aren't going up as much as then staff need to pay to live, and they're being offered jobs outside of healthcare for a lot more money, and we're just simply not able to pay them more money due to our reimbursement rates. So the Medicaid reimbursement rate is probably the biggest one. That's the first item on this, as well as the second one is increasing funding for programs for CNA training as well as nurse training. One of the big ones is nurse training. Every nursing school has a waiting list in Eau Claire. At least when I was in college, which wasn't that long ago, you basically had to have a 4.0 to get into the nursing program, which is just not feasible. And that's crazy. It just means there's not enough spots. The main reason for it was they had to have a way to lower the pool, have less people there because they don't have enough spots for the students that want to become nurses. So there is a problem with there's not enough people that want to work in healthcare. But there's an added problem of there are people that want to that aren't able to due to education. So that is the second ask, is to broaden that. A big part of that is the teachers that teach those classes. There are not enough nurse educators, and that is also due to money. It is more lucrative to work in healthcare than it is to teach healthcare. So there's very few nurse educators that want to teach because you could have a job at a hospital that makes substantially more money. So there are not enough teachers, not enough classrooms, not enough seats for students. And they're getting turned away and then choosing a different field or trying to get into a different program. And then there's 2-year waiting lists, lots of issues with that. As well as we are having now issues with testing for nurses. One of our LPNs that graduated as an RN, it took 3 months to get a test date. So she could be an RN right now, but had to wait 3 months to hear back from the state to get a test date. So it's just increasing problems than what we already had, because there isn't people to proctor exams, is what they're saying is. It is. So it all kind of revolves around staffing and money paid to people to staff programs as well as proctors and things like that. The additional item I had at the bottom of this is, in the past, we had an item on our legislative agenda, and it should have been removed because it had been discussed a couple of times, but I put it on here specifically that the CBRF and having any sort of additional licensure on our property, there is a regulation that prohibits counties from having both the nursing home and CBRF without going through a process called heightened scrutiny that takes years to do. It's basically revolving around the HMO and managed care payment system. It's very in-depth, and we don't need to go too far into it today. But when that's been looked at in the past as a legislative agenda item for the county to have, it is actually a federal regulation. So every time we've brought it up to the state senators, congressmen, things like that, it has not really gone very far. So removing that from this, since this is directly directed at the state and not a federal organization, that's not something the state can change. So removing that from our legislative agenda, since it isn't something that they really have a say in, and focusing more on the reimbursement as well as the training for nurses and CNAs. Any questions on this at all?
Questions or things that you feel need to be added? Uh, Sean? Yeah, okay. Computer problems, no. This is an action item, so we would need to approve this if we feel need to approve it now, or when, before you answer, when does this need to be into the executive committee?
Chris, you know that when,
We're gonna look for late fall.
yeah, I put it on here early so that we would have time to adjust things and add things.
Supervisor Bjork?
Thank you, Mr. Chairman. It's real straightforward, when speaking to legislators. for increased funding of nursing and certified nursing assistants. Is, but then you went on and talked about the places, number of students that can be enrolled in, and you spoke of the difference in pay from working in a facility versus teaching. Does that fall under what? I mean, if you know, I just got an idea that with all the things that goes in front of legislators, you know, their eyes would glaze over when you know, say we need this, we need this, we need this, we need that. Is there a name for that? I mean, you know, increased funding for certified nursing is, but what would be the ask for more spots for students and enhancing teacher pay?
I would say it would be increased support of the universities and funding support for the universities. There was, I believe it was actually Eau Claire received a fairly sizable grant to expand their nursing program, but that's only one university. So having increased support of the universities for their programs to pay their teachers and instructors more, as well as open up more spots. The other big issue, and this has been a thing for a long time, I don't know if it's only a Wisconsin thing or if it's a national thing, but there is restrictions on universities having programs that the university next to them has. So Stout doesn't have a nursing program, which because Eau Claire and River Falls do, which to me baffles me. I didn't know that until working here and going to Stout and saying, why don't we have a nursing program? We need to figure out how to start one. And they said, we can't. So that would be another part of that would be some sort of regulation change. And like I said, I don't know if that is a state or a federal thing, if that's something in other states or if that's just a Wisconsin thing. Or if the people at Stout were just saying that to say that, I'm not really sure, but that is what I was told when I approached Stout as what can we do to have a nursing program here to expand on nurses? So that would be part of it as well.
So for example, Eau Claire, or any place that has a nursing program, who decides what percent of the state funding that goes to the university goes to nursing? Does administration at Eau Claire decide what's go to nursing, or is it a percentage that all the campuses have to offer a certain amount to nursing? Do you have any idea on that?
I'm not sure on that. I could make a guess, but I wouldn't like to speculate on how that works. I would say that like Eau Claire had for a grant, would be maybe more grant or opportunities that would be guided or directed money towards universities from the state would be something that would be helpful. So then it wouldn't be, if it is the university's administration making that choice, then it would be guided money saying this money is for your nursing program from the state instead of general state funded money. I'm not sure on that one, but that would be based on, I'd have to do a little bit more research on how that works.
Okay, so I'm not being critical of UW Eau Claire, but if there is set, I mean, you know, everyone's got their own example, but if they're having such a shortfall in the area for nurses and educators to teach nurses, I mean, you could say, well, they're spending too much money on the football team, or just yesterday in the Eau Claire Leader, the band is 450 students. 450 students for the band at UW Eau Claire. Well, I'm sure that's a very important thing for some people, but somewhere along the line, somebody's got to put the squeeze on these universities that nursing programs are important. And I think the only people that can do that is legislators. If those decisions are made where university funds are spent. There you go.
So I take that as a support of number two.
Absolutely.
Okay.
And it's a request. to
Wait,
find out.
it's for the
I would
public so
just
they
like
can hear
to, I
it.
would just like to know who makes the decision
Sure.
on what money goes to nursing and what money goes to other areas.
So I can do a little bit more research on that and maybe adjust this to be more specific with that as well, with a specific ask if it is the university that does the choices of maybe changing this wording to say urge legislators to step in and enforce some sort of change.
Thank you.
Any other comments or Sean?
I think if we took number two and split it up, because they actually are two different
Yep.
really focuses. One, we need the money from the state to help with the CNAs and the nursing. The other is directly right at the university system. And if we break that up to just hit them with, providing the more seats or looking into, finding out if this, you can't offer what your neighbor offers thing is actually real or
It is.
it is.
Yeah.
Okay, well, that would be an easy one for the legislature to handle,
Mhm.
especially with the report on you just handed us. So if we maybe put the three and just make them quick, easy bullet points, because I agree with Larry, talking with them, if you get past 8 seconds, you're done.
Yeah, so this staff report is just for internal purposes. When it gets added to the county's legislative agenda, they are bullet points. So the overall agenda, this is more to describe it, so to decide what goes on that agenda. But the overall, these would be items on the larger county one, and it'll say from the neighbors of Dunn County Standing Committee and then our items bulleted.
Okay. But let's if we could break up two.
Sure.
To do one, asking for help for the CNA funding, get them trained, provide the training, and then two, to deal with the university issue.
Sure.
Thank you.
Yeah, by putting it out the way you did, it gave us a chance to see what's going on with it too. That's good. Any other comments? Okay, then, as we look at it here, we actually have 3 points. So it's an action item. I would take someone to put it forward and accept it as, go ahead, Sean, as you.
We could have it come back to me
Yeah,
to
we'll
read,
just,
because we have time.
Okay,
yeah.
just send it back.
just send it back and
Okay.
have it revised.
Sounds good. Anything else? Anybody?
I
Uh,
did have one thing.
Okay,
So next month, I just have a question, I guess, for everybody. On our regularly scheduled meeting, I will be out of the state. I can do it via Zoom, and Scott said that he would hook everything up for me, since he would be here and I could do it via Zoom. Or if you would rather have me be in person, if rescheduling works better. Otherwise, I am able to do it. I would just be via camera instead of in person. So it's up to all of you what you would prefer.
Well, since we have 5 Thursdays, or were we shooting for the 22nd or the 29th?
Let me pull it up.
we're talking September, right?
Yep.
September,
So
yeah,
22nd is what you're talking about, as far as you would have to Zoom that one.
correct. I would be gone on the 22nd in September.
How do you feel about Zooming? Is
I'm
this-
fine with it if it works for all of you.
Okay.
Never really heard it used as a verb before. Okay.
Yeah, let me pull that one back, huh? It's too late. Well, the 29th, it works for you, Corley? Does it work for you?
It does not. I will actually be at a conference,
Okay.
that one.
What do you,
So,
Yeah, the 29th, I'll actually be out of state also.
okay, so what do you say we keep it the same date and use Zoom?
Okay.
And we'll show up here
Yep.
and
works for me.
you'll be bigger than
I'll be
life.
on the
Yeah.
screen.
Yeah. Okay, so we'll keep the same date and you'll Zoom. Anything else, anybody? A quick comment is Carmen and I and Dr. Brown are going over to I don't know what it is. It's a meet and greet or
Meet-
it's kind of with the governor right now. So we're gonna take off quick and the
Yeah,
meeting is
one-
adjourned.
Oh, I have one thing. Was
Yeah.
item B an action item or is that just an item for discussion? I just wanted to clarify that before we.
It
got
was
on.
an action item, but you mean for next time?
It was an
Okay.
action item that was sent back to me for
So it's
revised.
just an agenda item then.
And it will be an agenda item, but
Okay,
action item
perfect.
next time.
That's
Yeah.
all I needed to know. Thank you.
Now then, we are adjourned. Thank you. At the City Hall.